Good evening, friends. At the outlet, I would like to thank our organizing secretary, Dr. Pooja Mehta, organizing another organizing secretary, a dynamic smiling person, Dr. Rohan Mehra, Dr. Tushya, Dr. Anshika, the young team, that's the youthful team of the IRSI headed by Dr. Himanshu Mehta, Dr. Amar Agarwal, Dr. Mahipal, and Dr. Gaurav Luthra. So, with this, I would like to share my stream. And my topic today, I'll be speaking on the webinars and conferences. I'm sure that most of us are flooded or bombarded with too many webinars nowadays. And here it comes. Who doesn't like to thank Dr. Himanshu Mehta? The big B himself has thanked. That means the whole nation would like to thank Dr. Mehta for his wonderful work. It's not only just Amitabh, but the whole country would like to thank. And thank you, Dr. Mehta, for this wonderful things what you are doing there back in Mumbai and all the organizing team. So coming to the topic proper, can I live without conferences and webinars? So there are two kinds of personalities, as we have all known. One is the extrovert, the another one is the introvert. If you see this, Bill Gates, Jeff Bezos, Elon Musk, they are actually the well-known introvert leaders, right? So let's speak about most of us who are not so seriously introverts like these people whom I mentioned before. So what will you achieve as an ophthalmologist? We would like to have a stable practice, fair amount of money, and a normal routine life. So now coming to live conferences versus webinars. We had a beautiful debate series between Dr. Honavar and Dr. Rohit Shetty. And these are the few glimpses of that. If you can see here, the sum total of travel associated with attendance at one large academic conference can release as much CO2 as an entire city in a week. It's almost 3 tons per person. And the carbon karma, an average 4 day with a 1,000-person national conference generates around 3,000 tons of planet. And an AIOS conference would generate about 30,000 tons of CO2. But on the contrary, what is happening now? The too much of social distancing. If you can see here, there are more than 1,000 articles now on the social distancing. And now it's been proven that it is causing depression, anxiety. You can see the pictures here causing more confusion, draining of the battery kind of symbols. So what are the benefits of meeting people? It improves the mental health, confidence and self-esteem, reduces the risk of Alzheimer's is what me and Dr. Rohit keep speaking about. And he's doing more and more research on that. And I'm sure that it must be true that physical conferences definitely gives a boost immunity, increased brain health and promotes the purpose. So webinars and virtual conferences, yes, definitely it's accessible to anyone, economical to organize, low carbon footprint, eliminates travel, speed, more value at a fraction of a cost, chat rooms, level playing field, anytime access, environment friendly. But definitely live conferences have its own charm. Meeting old friends, colleagues, sharing a meal, chance to meet the inspiring figures in your field, and nothing can replace the hands-on surgical training and demonstration. So can I actually be this? So how can someone make the best use of conferences and the webinars? The most important, I would like to tell all my young colleagues, the first important thing, if you want to be different from others, then that's the research. That's the publication. Your publication in reputed journals will attract organizers to call you as a faculty. It will be your contribution to the scientific world. Please remember that. And your name is there to stay for long. And definitely those who are applying for any other fellowships or job, it definitely boosts your CV. Opportunities for VR surgeon. If you can see that there's a major list of retinal related journals here, the various society which you should be a member of, especially the American Society, Retina Specialist, European Society, Federation of American Society of Experimental and American Academy of Ophthalmology. These are the few of the popular journals. Apart from the IJO, which is being very ably led by our own Dr. Honavar, we have the Retina, we have the Progress in Retinal and Eye Research, we have International Journal of Retina and Vitreous. And if you have any interesting case to share or something which is not so commonly seen in day-to-day practice, then definitely send it as a newsletter. This you can see the Retina Today as a weekly newsletter or a monthly newsletter. The next important is paper and poster presentations. My dear young colleagues, a good presentation will provide an opportunity to get noticed. It provides a chance to interact with the topmost leaders in the same field. For example, someone sees a great innovative presentation, a technique, and definitely they get inspired. They can spread the knowledge. And most importantly, it adds to their own personal modification ideas to make it even better. Who knows that the person who is sitting in the crowd, maybe your future employer, or maybe a partner, or maybe your professor, your mentor. So a memorable presentation may be the edge that made them select you over the others at the time of fellowship interviews. So what are the various opportunities for the VR surgeons? In the ASRS, we have Retina Image Bank here. You see the beautiful images, what you capture can definitely be showcased. So let the world know what you're doing. See, these are the few of the important images, and I'm proud that my own friend, Dr. Vishal Agarwal, who bagged the best retinal image of the year. These are the various other pictures you can see. So nice pictures. It's always better to see them. And these are all the award-winning pictures. And joining these kind of societies, like as I described, is the APAO, American Academy, European Vitreoretinal Society, Asia Pacific Vitreoretinal Society, will definitely give you an edge internationally. And please do not forget our alma mater, our mother society, who is none other than the All India Ophthalmological Society. And we welcome you all for AIOS 2021 Kolkata. Next comes the video presentations. The video presentations at the conferences are the one which brings the notice of the other ophthalmologists, especially in case of retinal surgeons, referrals. If they want, in fact, to tell you frankly, if you showcase your retinal surgical skills, then the people who are around you who want to refer will definitely think that you're a very good surgeon, and they will definitely increase your retinal practice. Platform to showcase your skill, what you're good at, and what you're doing differently than others. Just to give a glimpse of my story, this is the 4th year I bagged the ASRS Red Buckler Award, the prestigious Red Buckler Award. And this time it was a surprise that it was the best of the show. And I would like to give half of the credit to my colleague who was a fellow, now who is a consultant, who is Dr. Giriraj Vibhute. I did my surgery, but the animations, what all the things are required to make it necessary, a good video editing and animation are actually done by the youngsters. You people have a superb attitude. You know the technology very well. Just you need to make in a good collection of what you're doing, and the good use of the technology will definitely make you bag more and more awards. And now you can see you get your names, or your colleagues or fellows' name get published in the international journals or the international websites. And definitely we have a prestigious in All India Ophthalmic Society CS Reshmi Award, Rema Mohan Award. So it's always a kind of boost which you should try to do. I'm not telling that you should apply for the sake of award. You should keep trying and trying. If you get an award, it's always a boost for you, and so that you can fine tune your skills further. If you look into the ASRS Society, there's so many awards like Pyron Award, Founders Award, the ASRS President's Young Investigator Award, the PACO Award, the Crystal Apple Award, especially for only early career section. That means the members who have been in practice 7 years or less. See, there are so many awards these international and the national societies are doing to attract and promote and to reward these youngsters. We have our own Vitreoretinal Society of India. VRSI is now calling for interesting images on the retina. When I first looked at this Wyburn-Mason syndrome, I was stunned at I see this picture, and all credits to Dr. Deepak Bhojwani. Such a nice, wonderful picture, and the whole nation sees it, isn't it? The images competition, you have the best images. Now they are felicitated as the winners, first, second, and third. It's nothing but to give the youngsters more and more boost so that you can do more and more good job. Now, the online trauma video competition done by the Ocular Trauma Society of India. Again, our fellow Dr. Giriraj, he won one of the best video. So he was so happy, and now the whole institute is behind him asking how to make the edition and the animation. The other part, definitely you should look into this part. That is, now we have from the academic and the research, we have take a break session where we invite people to give a 1-minute video pearl, clinical photographs, so that it gets published. And so that more than 10,000 viewership is there for these kind of take a break session. And not to forget our own Dr. Lalit sir's idea between CCFS snippets. The whole picture, the whole lesson can be taught in few photographs with a few words, so that the residents or the fellows can definitely, it can be a refreshing kind of thing just to brush around so what they have read, and definitely it helps in their clinical practice as well. Now, if you become a member of these Vitreoretinal Society, your own parent bodies, then definitely you can see the Vitreoretinal job opportunities here for the people who are looking for the Vitreoretinal job. See, where are the current openings, in which all institute are there, what all requirements are there. It also helps in your current openings and the job opportunities as well. Now you have the different rounds, the Yanuzi round, which is picking up, and our own moderator, Dr. Neil Blessler, who has been the moderator a couple of times, where they invite the abstracts. So this is the podium where I request youngsters to please present interesting cases in such podium. And you have the ASRS Grand Rounds, which actually started in March. And you have late right Retina, the Joshi initiative, where Diva is in full smiles. Diva, Karan, and Purva, and many others are doing a wonderful job in the kind of Joshi, where they're trying to educate more and more, bringing the experts in the field and try to share in their knowledge. In the ASRS early career section, they also invite you to submit a case for the Retina Challenge. Fellows Grand Rounds is there. Submit as a spotlight case. Submit an innovative retina surgical video. See, so many options are now available for the younger generation to showcase their talent. And then we have fellows in training section. You can see the FIT videos, early career mentoring program, the Retina Career Center. You have the career planning, grant opportunities, etc. Now, I asked Pooja, she said, sir, a little bit about the international fellowships also would like to be covered in this topic. So observership, definitely it helps you, because observership internationally, it's a dipstick test before doing any long-term fellowship, because it is easy to get, needs advanced application. Some institutes ask for payment, but tourist visa is what is very much needed. If you look into the long-term clinical fellowships abroad, then definitely few of them ask for USMLE, and it's a strong CV and recommendation is required because it's highly competitive. You get a good exposure. Some of them are paid fellowship, but most of them offer you the stipend. And do we really need it? Yes, I think so, because it understands the different work culture, helps find a focus area, helps find different mentors. You see your mentors here. You can just have a glimpse of what is going on around the world. It broadens your horizon, widens perspective, provides the cutting edge knowledge, and stimulates to think different and do different. There are various other, if you don't want to go outside, you want to sit here, definitely there are a few other fellowships like Royal College, Edinburgh, Glasgow, and these are the various websites. You have the ICO, there's different types of ICO fellowships for the people who are just finishing their residency or just doing the Indian fellowship and they want to go in more ahead. Then you have the Retina Helmeric fellowships where they award you 25,000 US dollars timing. So is it really required? You just need to discuss this with your family and your mentors. I always keep telling my younger generation, please have a role model. Please have a role model, any teacher who would like to emulate, ask them. And definitely ask your own retina colleagues or your own teachers that whether should I finish before fellowship in India and then apply abroad? How much time do I have? Is it really worth applying for an international fellowship? It might not be. So it all depends upon your tailor-made approach, how you are, in what place you are, what practice you are going to do. So you have to make your own recipe. And does it add anything to my qualification? You just need to think about it. Should I just stick to 3 months fellowship? When should I apply? These are all the questions which keeps coming post residency. Definitely going in for these conferences, it's not just about learning, but definitely you will get to know more about what innovations is happening in the industry. So the top 5 improving efficiency. See here, these are all the youngsters who just you not see them, but you also see them how they innovate, what is their innovation, and how is it helping to our clinical practice. When you go into the wet lab, you get to operate the simulation based operations where you can do a wet lab where you can see the Centurion, the high end, the microscopes like the Ingenuity, RTO 300, 3D imaging system. Then you have the intra OCT system. You have wonderful gadgets. No, definitely you can just have a hands-on on them. And if you like them, then definitely you can go ahead with them. So I would like to tell all our younger colleagues, state conferences first to begin with are a very good platform, because some conferences have that they have a domicile purpose, then you are stuck there. But those who do not have the domicile, then that's the opportunity for you to go ahead and apply. Keep a track of submission dates, guidelines, format, resolution for the videos, use of these gadgets. I'm sure that you all must be doing using Google Assistant or Alexa. Definitely avail travel grants, competitions through quiz, papers, videos. Many conferences offer travel grants to the winners present at the conference, grants from the institutions, and you have various travel grants. And I think Diva it's his favorite topic, where he has spoken a couple of times about what are the travel grants, and he himself has got many travel grants. So this is the one which we started in Karnataka when I was the chairman scientific, the student of the year. The winner gets 1 lakh rupees as the travel grant to attend any international conference once he gets the best paper award. So this is the few glimpse of that. So when at conference, please make sure visit the trade area to know what's latest and what's trending today at the present time, to know the cost factors for future planning. Don't be shy. Walk up to the leaders. Chance to meet the expert. Make an impression that will last. Improve the chances of fellowships. So my first experience, I'll be finishing in a minute. My first presentation at RetNet and then presentation during observership at Toronto really helped me to get a long-term fellowship. Best video award at ASRS definitely boosted me. And these are the few of the things which Rohan was telling. It's the topic which is very close to my heart is the Argus 2 retinal implant. We did it with Dr. Robert Devaney, my mentor. And this is the whole team which we operated on 2 patients during my fellowship. And you know what? I was taken aback when Lalit sir chose me and he said, Srinivas, you have to come and give a keynote address. Just after my fellowship, and giving a keynote address at the prestigious All India Ophthalmic Society is something which it just woke me up and said, yes, we have to do something good. And many thanks to Lalit sir for picking up what we are doing. And I'm sure that you will definitely, if you're doing good work, you will be picked up. So don't attend a conference just because my friend is attending. It's such a cool place to just get away from the routine. Remember, it's not the strongest of the species that survive, not the most intelligent, but the one most responsive to the change, said by the Charles Darwin. And you know what? It applies even today. This is my last slide. When Steve Ballmer, the Nokia CEO, when asked the question during the press conference, he said, we didn't do anything wrong, but somehow we lost. When the analysts looked into it, they said they missed out on learning, they missed out on changing, they lost the chance of survival. So, my dear friend, the message of the story is if we don't change, we shall be removed from the competition. The advantage you had yesterday will be replaced by the trends of tomorrow. Those who refuse to learn and improve will definitely one day become redundant and not relevant to the industry. Thank you very much once again for this wonderful opportunity.